Hey guys, Dr. Tim Uselton here with Trinity Integrated Medical, and I want to talk to you today about the different types of care that you can get in an office like ours. It's pretty general, but it might answer some questions that we get on occasion. There's basically three types of care when you go into any type of office like ours. The first one is like the intensive care. It's like relief care. It's the person who calls on the phone and says, I've done something to my neck, I've done something to my back, and I literally cannot move. I can't turn my head. And when that person comes into the office, we're really looking at just ways that we can help them have a better day. It may include something specifically for their range of motion. It may include obviously an examination and set of x-rays to see if there's anything that's should not be touched. But then we usually can get through that, screen them relatively quickly, and then start in on some therapy. And that therapy could include some PT. It sometimes could include some muscle work. Other times it may even include like a shot of Toradol, which is a non-steroidal anti-inflammatory drug, into that area just to kind of calm it down. Because when it's screaming at you, it's miserable. There's nothing you can do. That would be what we call that intensive or relief care. We're just trying to get relief to the patient. The second phase of care would be more of a corrective care. Corrective care, if you compared what we do to say like what a dentist does, that relief care might be, I've got a really, really bad tooth and we're just gonna pull it, or I've got a bad cavity and we're just gonna fill it. Now, the corrective care would be like the orthodontist to the dentist. So the orthodontist is going to put some braces on your teeth. They're going to have a before picture of what they look like, and then they're going to go over a long period of time, sometimes up to a couple of years, with braces on, being tightened every month and making these subtle little changes. And then eventually they're going to take the braces off, or the Invisalign, or whatever method you're using as an orthodontist, and it's going to show you that they've changed. You've corrected that bad smile. Well, in our industry, we've corrected the misalignments, we've corrected the postural imbalances, we've corrected the weakness in the muscles surrounding the spine, we've corrected the tightness or the trigger points that are in that area that are keeping it in that bad position. And we're actually showing them a before x-ray of a bad looking spine or joint, and then through a certain amount of treatment, which in our case may take 3 months, may take 6 months, but we're gonna at some point take another set of x-rays and show you the changes that we made, kind of like a before and after picture, and that would show you that we are actually correcting a problem, not just giving you relief, because you might get relief after 2 or 3 weeks and then still have another several months to go before you actually achieve correction. That leads us to the third type of care, and that would be any type of wellness or maintenance care. Wellness and maintenance care is most easily described as, you want to continue on doing something that will prevent you from not maintaining the gains that you've made along the way. So if you got started with a real straight spine, like a hypolordotic, a head forward posture, and we were able to adjust a curve back into the spine, so now it's starting to shape like it should, the muscles are starting to tone down, and then you do nothing and you just get released. It's like getting released from the orthodontist or dentist and then never going back. Which, you'd say that's crazy. You made all this investment. You wouldn't want your teeth to shift back into a bad position. You'd go ahead and take that retainer. You might have to pay a little more for it, and then it's going to keep you in that good position for a long time. Well, our maintenance care is going to show you how to stretch, show you how to strengthen, show you new exercises, and keep you motivated to living a life that's full of wellness, not just waiting on the next time you need the visits, you need some pain relief. If you jump from pain session to pain session to pain session, what you get at the end of a certain amount of time is lots of osteoarthritis and wear and tear that then becomes something that's more difficult to treat. But if you can correct the problem and then maintain that correction, you stand a better shot at living a much healthier life that's full of wellness. So a wellness-based practice may have patients that come in saying, no, I feel great. I don't need anything for acute pain right now. I just want to keep what I got. So give me what you got. Keep me in that good alignment. Give me the good posture. Make sure I'm balanced. Give me some new stretches and strengthening exercises to add to my repertoire. And then there you go. You stay good. So it's intensive care to get you out of pain, maybe the first few weeks of a corrective care plan. And then it's corrective care when you're out of pain, but we're going to continue on getting you treated so that you can end with a better result and end with a true I look and feel differently than I started with. And then 3, maintenance care or wellness care. Maintain the symptom-free life, the pain-free life, and continuing to get bigger and bigger and better with your results and the pain that you normally have. So hopefully that explains the 3 phases of care in most offices like mine. And if you have any additional questions, feel free to reach out or comment below. It's Dr. Tim here with Trinity Integrated Medical. That's trinityintegratedmedical.com. Thanks for watching.